Surely we cannot be so stupid to go and just say we are bringing a disease and carrying it and sprinkling it amongst our people. No. We are actually being proactive.
Fellow Kenyans, it is quite a pity that some of us still believes that this government normally follow court orders. This government does not follow court order no matter what, because as we speak right now, of course, we know very well the headquarters as withhold the building of quarantine, Ebola quarantine in Laikipia. That is according to the High Court. That is according to the court. But what about this government? What about William RUTO? Did he withhold? No. As we talk right now, as we're speaking right now, these people have started doing they've started building quarantines in Laikipia, and the airbase is continuing to land. As you can see in this video, by the way, this is the airbase, and of course we know how big is airbase. We know what it can do. We know it can carry anything. I think it's this airbase, is it normally a C-what? It's I think it's I don't know, but I think it's C-113. It's the largest, the world's largest aircraft, which can lift anything. Anyway, I don't know why this government is so much obsessed with this Ebola quarantine and everything. So that is basically what I want us to talk about. But before that, let me humbly request you that if at all you're meeting for the first time, please don't forget to click the subscribe button. You can also like, share, drop me a comment in the comment section, tell me what to think and where exactly you're watching this video from. And also, after the Bonita Media community and family, guys, I have an announcement to make, and this is the announcement. To the Bonita Media community and family, fellow Kenyans, we have a project here. Actually, it's a very painful story, but I will request all of us, if you're watching and you are willing to help, I would like us to come together to at least help this family. They really need help. They've been struggling. They've been in pain for a very long time.
Sasa yale napitia ni mtoto wangu mkubwa.
Ndiye first born,
Ako na watoto wawili. Lakini hajifanyiangi chochote, ni kuanguka tu. Na saizi hata sahi vile tunasianga wanaume pia ni wakudanganya watu. Ako na katoto saizi kachanga.
Mtoto mdogo
Kabisa, kama miezi. Na unaona huyo mtoto hakuna kitu anaweza mfanyia. Hata umwache hapa kwa nyumba, hawezi akapea mtoto chakula, jua na shake nini?
Mwili.
Utamuona na wako na malama, unaweza sema ni pombe anakunywanga na si pombe. Ni kuumia huyu mkubwa sasa mama mtoto. Sasa unaona nisipokuwa karibu naweza pata mambo ingine. So huyu mtoto naye mdogo hakai chini, na miezi imefika ya kukaa. Akakai chini mtoto kake. Hata pia nako unaona tuka na shake nini kichwa.
Ako weak,
ako weak sana.
Now, I don't want us to talk too much about this, fellow Kenyans. I'm just requesting that let us stand with this family. We find a way of standing with supporting this family. Your 50 bob, your 100 shillings, your 200 shillings will really be enough, because according to me, I think the best thing to do is to find a way on how we can take this child, this lady, back to the health center. At least aende akafanyiwe check-up every now and then, because she's supposed to be going for this check-up thrice a month because of that condition that she is in. You see, akiwa kwa hiyo condition, it's very difficult even to take care of the child. Na umesikia mamake anasema ya kwamba mamake haizi akatoka nje, kwa sababu akitoka kidogo hivi akirudi pengine huyu msichana ameanguka, kwa sababu nimekuambia kuna ugonjwa wa kuanguka, pengine ameanguka, na akianguka basi mambo inaweza karibika, hata anaweza kaua mtoto. So first things first, I think what we can do is let us just come together, we support this family, tuhakikisha kwamba huyu msichana ameenda hospitali na amepata matibabu yale ambayo amekuwa akiyapata kila mara 3 kwa mwezi. I did what I could, because they didn't even have food. Nimewafanyia shopping kidogo pale kwa kile ambacho nilikuwa nacho. Nikawapa kile cash kidogo, alafu pia nikamnunulia dawa ambazo zinaweza ikamsustain for the time being. So I'm just requesting you guys that we come together, we support this the lady. At least kama tunaweza mkamsupport, hiyo health condition yake ndio imeniuma sana. And then unasikia kwamba mamake pia ana ugonjwa na ako positive, so it becomes stressful. Na pia umejua hiyo pressure pia inaweza panda. So kama tunaweza pata tu watu, mtu aseme kwamba mimi niko na 1000 hapa, acha nikutumie 1000, 2000, 5000, 10000, 500 tu, 100, 200, hata shilingi 50, najua itafanya kazi kubwa sana kuhakikisha kwamba huyu msichana pamoja na mtoto wake wako kwa hali nzuri. You know, the hand that giveth is the hand that receiveth. That is normally my norm. That is what I normally say, that ukipeana kwa roho ulio wazi, nawe pia utabarikiwa. We are not forcing. I know saizi mambo imekuwa ngumu, hali ni ngumu kwa kila mmoja, lakini tukija wote pamoja tuhakikishe kwamba tumesaidia hao watu. Pengine Maulana anaweza kasikia maombi. We never know where the blessing is going to come from. Just use the number of the screen, and then I know that all is going to be well. Now, as we embark on our discussion, let me first say this, that this government being led by our president, William Samoei Ruto, in fact, he is that court. He doesn't need approval from any court to do things that he wants to do. That is one thing I believe. I know that William Ruto does not, in fact, haitaji chochote. He doesn't need anything from any court. In fact, according to him, that which you are doing or that which you want to do, that is up to you. According to me, what I do, what I've decided to, that is exactly what I do. That is what William Ruto is trying to tell us, that, okay, you know what? I've decided that Ebola patients are going to be quarantined in Kenya, and that's final. And what is funny is that the Ministry of Health being led by its PS, is saying that we are going to allow Ebola patients into Kenya, because during the COVID-19 period, we had thousands of patients coming to Kenya for quarantine from all over the world.
Surely we cannot be so stupid to go and just say we are bringing a disease and carrying it and sprinkling it amongst our people. No. We are actually being proactive. In the event this disaster hurts, what do? So we must be prepared for both the citizens of Kenya, and also be prepared because we are a significant player within the international arena. So this is sometimes how you are misinterpreted, or how we are misinterpreted, but you have the nerve, you have the resilience to be able to withstand and be able to project and explain some of these situations effectively to our other people and to the citizens of this country. So as you undertake your exercise, as you do your interaction today, just know that you carry a lot of load. Sometimes that famous phrase, weka mawe, that is used. I don't know whether they know exactly the implications of that, because it's a weight. If somebody puts those stones on your shoulder, or those weights, it's not easy to lift.
COVID-19 and Ebola, are they the same? No. Tuzungumze kweli. And who knows whether corona was there or not? Who knows whether this story of COVID-19 was true or false? Ebola, we know Ebola is killing people in DRC Congo, and that is why even Museveni has blocked his borders. Nobody can access Uganda from DRC. Right now, your president, my president, ameamua kwamba lazima wafanye, and they are talking about improving healthcare. If this is the best way, if this is the only way that the government is thinking that the healthcare of this country can be improved, then they better stop it.
Anything that comes from an international request it goes by the laws of Kenya. So we will not be breaking the law to have a conversation with partners. Not just the US, but any other partner. It goes by the laws of Kenya. So we want to affirm that our country we are ready, we are capable, and the ministry, we have taken all actions to ensure that we continue being guided by our healthcare workers and our policies to protect our boundaries and also to ensure that every Kenyan is very, very safe. As at yesterday, and you know very well, the World Health Organization declared the situation of Ebola as a public health emergency of international concern. And that was just the other day in May. The Africa Center for Diseases, they have subsequently declared that it is a public health emergency of continental security. And in DRC, we have many cases that are suspected, but they have already lost more than 100 people. In our neighboring country, just here in Uganda, they have about 10 cases, 7 to 10 cases that have been confirmed, and they already have a death. So our proximity to these countries is what should keep us on set, and we are on high alert as a ministry. Therefore, cross-border importation has been confirmed in those countries, and we are doing whatever possible. If you go through the airport today, you must be screened. You're coming back, you must be screened. And we must isolate those people who we may have to suspect or that need to be isolated from other people. As at yesterday, we do not have any confirmed case in Kenya. Yes, we have had samples. We have taken them to the laboratories, the designated laboratories, because not all laboratories have the capacity to do that. And we remain at risk of the disease importation. So let's all be careful. If you don't have an urgent travel in those countries, why do you have to go? Kaapa. Then we have also mapped out the high-risk areas, in our country. But we are continuing to screen people, travelers. More than 55,000 travelers have been screened. We do not have any traveler in isolation as at now. We do not have any traveler who has been taken on referral. We have our rapid response teams on the ground 24/7, 24 hours on standby also, just in case there is any call. I want to say that international collaborations happen every other day. And when there is a discussion around having an isolation center in Kenya, it's not a bad thing really, and it's a discussion. Because emergence of diseases and reemerging of diseases will keep recurring every other time. Really, as a country, we must be ready. And these are not strange things. Even during COVID, we had isolation centers in our country. Even the counties are supposed to have isolation centers. Today, we are at risk because of Ebola. If we have it here in our country, what happens? We will need isolation centers in response to the ongoing regional outbreak. We have been able to activate our national incident management system. And the government has also intensified surveillance at ports of entry. You have heard my CEO from Cambry is at the border coordinating issues at the points of entry, designated specific laboratory for testing and we have also strengthened both national and county level coordination. it is a matter of life and death. We do not have an excuse as to why we must not get ready to protect Kenyans. And our labs have really been enhanced. You know, in 2019, 2020, during COVID, we could send our samples as far as South Africa. That is how low we were. UK, India. And it will take 1, 2, 3, 4 days before it comes back. And then we could say there's a confirmed case. But today, our labs have the capacity to test and give results within 6 hours, 6 to 8 hours. So that's an improvement. And we will continue to ensure that our partnership with other players, we are enhancing, and the testing of our samples in the country. We are also very deliberate on long-term investments in terms of health systems, public health surveillance, and workforce development. And notably, Kenya Health Professionals, previously, we have supported other countries in the response, and especially during Ebola outbreak in West Africa between 2014 and 2016, we had to send our healthcare workforce to go and assist them.
I don't know what people like Aden Duale are doing. And imagine Laikipia, mimi si watu wa Laikipia wanaenda kukufa. It is something that is happening. This is something that it is not like we are thinking of it. It is something that is happening. It is something that is there. You understand? This is something that is there. It is something that is happening, and it's something that you cannot. In fact, no one can run away from this thing because it is happening. It is there. It will continue to happen. And William Ruto is saying nothing about it. William Ruto is just minding his own business. He's continuing to sign some of the bills. You really wonder, all these bills that this guy is signing, what are they for? What are they for? People are dying, people are suffering. We mwenyewe unaendelea na mambo yako huko hapa na pale. Can we just resonate with Kenyans? Can we just reason the way people want things to be done? It is not like we are forcing you, but can you just look at the way you're doing things? Can you just stop imagining that, I don't know, this, I think what is happening right now is, remember when there was the issue of mara watu walikula pesa ya COVID-19, Uhuru Kenyatta alikula pesa ya COVID-19. So William Ruto also wants to get into that line. And I've been asking myself that jinsi tunaelewa hii serikali sahi. Suppose COVID-19 found William Ruto as the president. Nini ingefanyika? Let's just assume that William Ruto was the president back then during the COVID-19. Nini ingefanyika in Kenya? Si Kenya watu ingeisha kabisa? Because at the end of the day, the guy is just after money. Anataka tu kutajirika. Anyway, that is just my opinion and that is my thought. Let me also know what you think in the comment section. But I think this issue of Ebola, there is somebody or there are some people who wants to benefit from it, or maybe who thinks that we can get a lot of money from this issue.